Well, good afternoon, everyone. Thank you for joining us on this cool spring day. We are here to receive the latest situational report, the May 4th edition on the local COVID-19 situation. I would like to start us off with a land acknowledgement as we take a moment to pause and think about this beautiful land we call home. So we respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, so to start us off, I would like to invite our Board of Health Chair, Mayor Andy Mitchell, to share some opening remarks. Please go ahead, Mayor Mitchell.
Thanks, Brittany. We live in the strangest of times, COVID times, a mix of pessimism and hope. The third wave has been difficult. More local deaths, record number of cases, contact tracing required for so many, and a lockdown and stay-at-home order that seems to go on forever. It is wearying and reminds us of what is now gone. 14 souls lost. Businesses and jobs and the security they gave us disappeared. The companionship that nourishes us curtailed. Special moments, birthdays, graduation, reunions, not held. Embracing an ailing parent. Special moments never recovered. It can crush us. But it is also a time of hope. Almost 60,000 doses of vaccine have been administered locally. Supplies are rapidly expanding. Our capacity to deliver is nearly 2,000 shots a day, and herd immunity will be a reality long before we thought possible. But beyond experiencing hope and despair, which in time will fade, I will remember the people of Peterborough City and County, who day after day show the strength and courage to battle the impacts of COVID-19, and who are determined to both tolerate health restrictions and to embrace vaccine. The actor, Christopher Reeves, a person who faced great personal adversity, said, "A hero is an ordinary individual who finds the strength to persevere and endure in spite of overwhelming obstacles." This so aptly describes the people of our community. To everyone, it is your heroism, above all else, that will remain with me long after COVID-19 is defeated. Stay safe, be well, and in all things, be kind. Thank you.
Thank you very much, Mayor Mitchell. Okay, so let's have a look at where we stand in terms of the statistics. So I'll invite Dr. Salvatierra to give us a highlight of these statistics. Go right ahead.
Thanks, Brittany. So as of 4:30 p.m. yesterday, there were 75 active cases here in Peterborough, and this is 7 fewer than we reported on Friday. Most of these continue to be cases that are infected with the variants of concern. You'll also note on the dashboard today that the number of high-risk contacts continues to decrease. It now stands at 193. That's down 26 from our last briefing, and it certainly is a welcome change from the over than 420 high-risk contacts that we were following just 2 weeks ago. Next slide, please. As far as new cases weekly, you can see here that we reported 66 new cases, both for last week and the week before. And while these cases are lower than the week of April 12th, when we spiked at 112 new cases, we are certainly not seeing a consistent decline in the day-to-day and even weekly case count. So next slide, please. Here you can see that we had 351 new cases reported in April, and that was a 50% increase over March, which had been our previous high water mark for the monthly cases. So I believe this reflects how much more transmissible the variants of concern circulating in our community can be. It also reminds us that until we reach higher vaccination levels, we cannot let down our guard on public health measures and the need to adhere to the stay-at-home order. Next slide. The gender breakdown remains fairly even between men and women. And again, in terms of ages, you can see that more than half of our total cases, or about 634 in total, are under 29 years of age. This is 34 more cases in this age band over the past week alone. Next slide. The percentage of community spread remains about the same as last week, and it's at 18.7%. This is a key indicator to watch because it tells us how well controlled the outbreak is or isn't. It's also interesting to note that despite the stay-at-home order, over the past 4 weeks, we've had a few cases that have been related to travel. On the next slide, we give you our latest testing data. We've topped the 50,000 mark in terms of local residents who've been tested at least once, and that is 650 more than the previous week. So good to see that we still have high weekly testing rates in our community. As far as outbreaks goes, we are at 7 active outbreaks. There were 2 new outbreaks declared yesterday. Both were in daycares. And we were able to declare the outbreak at Trent's Champlain College over. All other outbreaks remain stable. So today I'd like to provide a further update on the provincial vaccination plan as it continues to expand at a fast and furious pace. This is all good news because it reflects the fact that Ontario is getting more vaccine, and we will see that here in Peterborough soon. So to recap, and I believe you've got a slide, there we go. To recap, last week the province opened up vaccination to everyone over the age of 55 years, and also to licensed childcare workers. As of 11 a.m. this morning, we had about 4,500 appointments still available for the rest of May in our local vaccination clinics. So if you belong to any of the groups that are already eligible, please book your appointments as soon as you can. This week, so we're looking at the column May 3rd. So likely on Thursday, but we'll see, the province will announce that everyone over 50, so 50 years of age and over, will become eligible, as will the individuals with the high-risk health conditions, and as well the first group of people who cannot work from home. We're ramping up our clinic operations as more vaccine becomes available for us, and we do expect to be back to a full 7-day-a-week operation before the end of the month. We are also planning for those who will need their second doses starting in June. So all of that's going on in the background. If you would like us to notify you when it's your turn to get vaccinated, because it is a little confusing now with the hot spots vaccinating, you can still sign up at www.peterboroughpublichealth.ca/notify-me. New age bands and other groups will become available very quickly over the next few weeks, as shown here. And by May 24th, everyone 18 years of age and over will be able to book an appointment either online or through the provincial call center. In the meantime, as Mayor Mitchell has pointed out, it's an unusual period for us in the pandemic as the light is getting brighter at the end of the tunnel, but we are still in the midst of a stay-at-home order. I know for many parents, it continues to be a very trying time as they balance supporting their children with virtual learning, as well as trying to work either at home or as an essential worker out in the community. We are so grateful for all of your efforts. And I just wanted to offer a few thoughts about what families can do safely to keep their kids busy during this challenging time. Here on this slide, you can see a great resource for parents. It's called the Pathway to Stewardship and Kinship Program. It offers great ideas according to the different age groups in your household. Getting kids outside can have a positive impact on their mental and physical health. Each of these activities aims to promote community connections and environmental stewardship by engaging children with their environments at a young age and continuing to foster that relationship as they get older. Gardening is a great thing to do at any age, and even if you don't have a backyard. You can plant an herb garden or container garden by a window with healthy things that you can eat later. For children aged 8 to 9, this is a great time to try out new skills like biking or tree climbing. Older kids might enjoy heading down to a local creek and discovering a new nature area, turning over the rocks and seeing what wriggles out underneath. Just head to the website www.pathwayproject.ca for lots of wonderful ideas. We are lucky to live in Peterborough City and County with so many outdoor options. Here are a few options of all the free recreational activities that you can enjoy locally. Our neighborhood sidewalks, streets, multi-use paths, and dog parks are all available to get outside and keep moving. When doing these activities, some ways to stay safe include stepping aside to pass others on sidewalks. Passing someone briefly on a sidewalk is not considered a close contact and does not pose a significant risk of exposure for COVID-19. Maintaining 2 meters of physical distance at all time from anyone who is not from your household. Wearing a mask outdoors is strongly recommended, particularly if the location that you are going to is busy or crowded. When moving at a fast pace, such as when running or cycling, increase your distance from others. Please keep dogs on leashes. And don't forget to clean up after your pet when you are using our trails or parks. With so many birds nesting at the moment, this is not the time to let your dog roam freely. And limit non-essential travel and avoid traveling to other communities at this time. We have lots of great amenities for you to enjoy in our own region. So thank you. Over to you, Brittany.
Thank you very much, Dr. Salvatierra. Okay, great ideas there. So now let's hear from our elected officials, and I see our municipal representatives are here with us, which is wonderful. So let's start with Warden Jones from the county to bring us any remarks. Please go ahead, Warden Jones.
Okay, Brittany, thank you. I trust you can hear me okay. I'm going to be short and sweet today. Not much to report from the county perspective. I guess I just want to say how proud we all are of county residents who I know are doing their very best to obey the rules, and we hope we'll keep doing that. And let's just try to keep a smile on our face as we get through this. As we said before, light at the end of the tunnel, that's for sure, but we've still got to hunker down. So on behalf of all of us at Peterborough County, please do what you're supposed to do and maybe find time to have a smile, okay? Thank you to everyone for doing what you're doing. Thanks.
Thank you very much, Warden Jones. Always great to have you with us. And I did see the mayor on the line, Mayor Therrien, but I don't see her now. So maybe we'll have to come back to her in a little bit. Actually, Brendan, do you have a quick update on whether the mayor will be able to join us today?
Hi, Brittany. Sorry, I haven't heard from the mayor. I'll double check, but I haven't had confirmation that she'll be joining us today.
Oh, okay. Okay, well, we can move on to our questions then. Okay, so thank you very much to all of our media partners who are here today. And we're also fortunate to have Chief Scott Gilbert from the Peterborough Police Service joining us. So let's start off with our media questions, and we'll begin with Matt Latour from our local radio stations. Please, if you've got questions for Dr. Salvatierra or Chief Gilbert, please go right ahead.
Yeah, I've got 3 questions today, all for Dr. Salvatierra. My first question has to do with, I saw NACI yesterday. They put out a statement about the Johnson & Johnson vaccine, about it being available for 30 plus. But they also noted that it's a good vaccine, you know, if you can't wait for an mRNA. I think I got that right. And I know kind of the messaging from you this whole time has been get whichever vaccine you can get first. And now this kind of sounds like they're saying maybe get the Johnson & Johnson. What's your take on this statement they put out?
Well, Janssen is a viral vector vaccine, just like AstraZeneca. And we know that the viral vector vaccines are associated with a rare, but a very serious side effect. And that's the vaccine-induced thrombotic thrombocytopenia, or VIT. And so because of that, certainly the messenger RNA vaccines have an advantage because they don't have this associated risk. However, I think it is important that all the vaccines are effective, and that depending, and what NACI does is it says it really depends on your circumstances. So if you live in an area like Peterborough, where you're having moderate to high transmission of COVID, the benefits of getting the Janssen or the AstraZeneca vaccine outweigh the risks, including those very rare, the rare risk of that immune disorder. If you live in a low risk area, perhaps with only 1 or 2 cases of COVID a day, then potentially the benefits don't outweigh those risks, because the risks are so much smaller of getting COVID-19, and it may be preferential for you to wait to get a messenger RNA vaccine. So that's some of the nuanced recommendations that NACI provided yesterday, and it makes a lot of sense when you look at the actual numbers, and hopefully not too confusing. So I would say the bottom line is that in Ontario, given the fact that we are in a wave 3, and given the fact that we have high transmission occurring, moderate to high here in Peterborough, it does still make sense to take whatever vaccine you can get. So the first vaccine you can access remains the best vaccine for you at this time.
My next question had to do with, I know a word we've been hearing a lot more recently is herd immunity, with more and more vaccines being rolled out. Is it possible to achieve herd immunity once a certain amount of people have just 1 dose, or would they need both doses for that?
I believe it is possible. We know that, especially if we have data from Ontario. We've immunized enough people that we can see how well the vaccines are working, and it does appear that by 3 to 4 weeks after the first dose, that we are seeing from 60 to 80% effectiveness in preventing an infection. So the vaccines do work well, but you need to wait 3 to 4 weeks. And it could be that if you can get a large proportion of your eligible population immunized, that you can take that effect from even just one vaccine, one dose alone might be enough to bring the outbreak under control and allow us to enjoy some of those benefits of herd immunity.
Perfect. And my last question, kind of circling back to NACI, I know they're looking into the possibility of mixing the vaccines, one for one dose, one for the second dose. How much would this speed up the timeline, I guess, here in Peterborough and across the province in general?
Well, I don't think mixing the vaccines is going to speed up the timeline. The timeline really depends on the availability of all the vaccines coming into the province. And even, for example, with AstraZeneca now being in short supply, and I know we have lots of people here in Peterborough who are a little getting worried, like, will there be AstraZeneca for me when it's my turn to get my second dose? Right now, we believe there will be. And again, the NACI recommendation is to complete your vaccine, your immunization with whatever you started. So if you started with AstraZeneca, second dose should be AstraZeneca. If you started with Pfizer, stick with the Pfizer. The messenger RNA vaccines in a pinch can be interchanged. So if you started, let's say, with Moderna, and we have no Moderna in the freezer right now, potentially you could get a Pfizer instead. But there is some really fascinating research taking place right now where they are purposely mixing and matching the vaccines. And there's some promising results starting to emerge from this research, which show that there may actually be an advantage of mixing and matching, that our immune system can benefit from being nudged in a different way. So I think we just need to stay tuned and wait for that research to be published, and perhaps in the next weeks and months I may have a better answer for your question, Matt.
That's it for me. Thank you.
Great. Thank you very much, Matt. Okay, Paul Rellinger from Kawartha now. I'm sure you've got some questions for our speakers. Please go right ahead.
I do. Thanks so much, Brittany. For hi, Dr. Salvatierra. For you, I had a couple questions. A couple of daycare outbreaks have been reported. It's been a while since we've had a daycare outbreak. I think there was one in Buckhorn, if I remember, early on. And I'm wondering if that raises any particular concerns that we're now starting to see COVID in those settings.
Well, I believe what it demonstrates, Paul, is really just that we've got community transmission taking place, and typically people will bring whatever they've been exposed to from their close contacts. They'll bring it into their workplace, whether that's a personal service setting or it's a school or a daycare. And we know that adults are much more likely to transmit than children. And there's good data to show that. So I think that explains why we are seeing the 2 daycares this week. These are infections that have been brought into the daycare, typically by a staff person, an adult who's been infected either from a household contact or from socializing.
Great, thank you. The last media conference, you mentioned May 17th as being the week kind of circled on your calendar, vaccines arriving in the region. I just want to clarify that we're still on track for that?
Yes, we are. In fact, so May 17th, as you recall, I said it was going to be the watershed for us because that's when our Pfizer vaccine is scheduled to double. And I've seen some additional projections, some planning projections that were shared with us over the weekend, and that continues to be the case. So looks good for May 17th here in Peterborough.
Okay, thank you. And then one more thing, I just wanted to follow up on Matt's question regarding AstraZeneca and the potential mixing of vaccines. So if I'm hearing you right, and you're right, there are a lot of people who got AstraZeneca. I'm probably one of them squirming in my chair right now. But even if for some reason this shortage of AstraZeneca continued, you foresee a situation where people will still be able to get a second dose? It might not be AstraZeneca though.
So the province is saying right now that the expectation is that you will get a second dose of AstraZeneca. And so I think it still looks good for people like you and others that had that first dose, that you will be able to get a second dose. And it's good to know that there is research happening right at the moment looking at the potential of substituting that second dose and using a messenger RNA vaccine instead. And that so far we're hearing really good news that the results are looking good in those trials. So you know, it's hard to know what the future holds, especially with COVID, because things can change so rapidly. But by the time you are due, which is for AstraZeneca, well, it's all 16 weeks right now. The earliest would be 12 weeks. By the time you're due, we'll either have more AstraZeneca or we'll have other good news to share with you.
Perfect. That'll put people's minds at ease, including my own. So thank you so much. I appreciate it.
Okay, thank you very much, Paul. Okay, let's hear from our colleagues from Global News. Jessica Nisnik, please go ahead.
Hi, Brittany. Hi, Dr. Salvatierra. My colleague Katrina is actually going to ask some questions first.
Hello. I actually have a couple of questions for Chief Scott Gilbert regarding police now being eligible for vaccines in Ontario starting this week. So, Chief, I'm just wondering, as we're seeing more people becoming, you know, unsettled as this pandemic drags on, as we saw a couple weeks ago with the number of people that attended the rally here in Peterborough, I'm just wondering how important is it for police to get vaccinated, especially during this time?
Well, it is. It's very important for our members to be protected, given all the activities they have to engage in the community. We don't get to pick and choose whose house we have to go to when they call 911 requesting assistance. But I do have to clarify that our frontline officers were eligible through phase 1 some time ago, and our frontline officers, meaning our uniformed constables and sergeants, as well as our special constables, were vaccinated in phase 1 already. And obviously, with it opening up to other members, then support staff, communicators, etc., then they're eligible in the next phase of the rollout.
Okay. Do we know what this set of vaccinations will look like? So will police register just like, you know, the rest of the population, or would there be some type of mass vaccination clinic set up at Peterborough Police?
So what we had to do was submit a phase 1 and a phase 2 list through to PRHC, Peterborough Regional Health Center, and they were the ones that were sending out emails to our members, and they'll do that for those that are eligible in phase 2 for them to book an appointment to go in and receive a vaccination. So it'll be done through the hospital.
Do those frontline officers that you're referring to earlier, do they have both of their vaccinations yet?
For the most part, I would say all of those officers have had one vaccination, and like everybody else that's had one vaccination, we're waiting for that 4-month mark to get the second vaccination for them.
When will that 4-month mark be?
I think Dr. Salvatierra indicated that in June people should start receiving emails or notifications that they're eligible for their second vaccination. But we're waiting to see when PRHC actually starts to message our members. But I think that those that are eligible will probably start to receive it in and around that time, if not towards the end of June or early July.
Okay, thank you, Chief Gilbert.
You're welcome.
Thank you. I think, Dr. Salvatierra, just one question for me. Do you know if we're going to go back into the colors, the color-coded system when we get out of this shutdown?
We have not had those conversations yet with the Chief Medical Officer of Health, so I can't give you a definitive answer, although it does make sense that given what that the current weekly incidents and other indicators would be taken into account when we come out of the stay-at-home order, and it'll be different from place to place. So it's too soon to tell. I think as we get closer to May 20th, I may have some clearer direction for you.
Okay, thank you. That's it. It was more or less, I had questions about the vaccine cocktails we're talking about, but they're all answered. Thank you.
Thank you very much, Jessica. Okay, I see Greg Davis is here with us as well from Global News. Did you have any questions for our speakers today, Greg?
Yeah, just maybe for Chief Gilbert or Inspector John Lyons. Has there been any further updates regarding the anti-lockdown protest? And how was this past Saturday's protest compared to the week before?
I'll let Inspector Lyons answer that question for you.
Hi, Greg. So last weekend's protest was attended by about guesstimates between 150 to 200 people. But again, making sure that they were safe was our priority. As well, we are still following up on charges for those individuals that have been identified. And that will be ongoing, unfortunately, from weekend to weekend. Officers are spending a fair bit of time identifying and then going out and charging individuals. And I can tell you that will continue as long as these protests continue under the current stay-at-home order.
Has there been any charges from this past Saturday's protest?
As of today, no, there hasn't, but there have, again, there are people that are being identified and there'll be follow-up to charge those individuals.
And one last question, are you seeing familiar faces at these events?
Yes, we are. We're seeing people that are coming week to week. And those are the individuals that I would call the organizers. And they have made it clear to us that they will be attending every week. And we have now been charging them, unfortunately, due to their own actions every week they've been there.
Okay, thank you, Inspector Lyons. Appreciate it.
You're welcome.
Great, thank you both. Okay, so let's hear from our colleagues at the Peterborough Examiner. Joelle Kovac, do you have some questions for our speakers today?
I wonder if you can come back to me at the end. Thanks.
Okay, sure thing. Then let's hear from Bill Hodgsons. Bill, do you have any questions?
Just two for Dr. Salvatierra. And I don't even know if you can answer the first one, but with regard to the daycare comments, is it adults that have tested positive or children tested positive as well?
We have both staff and children in the daycares that have tested positive at this point.
Okay, and totally different route. Just because people have been reaching out to me, more people are buying online and such, and there's concerns about Kijiji Marketplace, meeting up with people like that. Have you had any concerns with the health unit, and what sort of advice would you give to people who are buying online in that fashion?
I think that sounds like a great question for our police partners. I'm wondering if Chief Gilbert might like to take this. So it's about security concerns with buying online.
Not so much security. Close contact, meeting people in that sense.
Oh, more transmission. Well, I think all of the public health measures that we would use, let's say in curbside pickup, for people who are using that as a way to purchase and to secure needed items during the pandemic. All of those come into play when you're purchasing from someone online. So you need to use your distance, you need to mask, you need to wash your hands. Carrying it out outdoors is always safer than indoors. So it would be no different than going downtown and picking something up at the curb.
Fine. Thank you very much. That's all I have.
Okay, great. Thank you very much. Okay, let's hear from Trent Radio. Rob, if you're here with us and have some questions, please go ahead.
Hi, yes, thanks, Brittany. Just one for Dr. Salvatierra. It's wonderful that we're seeing the expanded eligibility for the vaccines, and it sounds like we're more or less on track to have vaccines to follow through with the eligibility. But there's a concern that I'm hearing that people are saying, oh, I might be eligible on such and such a date, but that doesn't mean there'll be a vaccine and an appointment for me to get. Like those two aren't necessarily closely related. So let's say someone's going to be expecting to be eligible next week.
Mm-hmm.
Do you have a sense of when they might realistically be able to get their first appointment?
So I think it is important to clarify. They become eligible to book their appointments. Because we need to manage expectations, given that we have 50% of the vaccines being redirected to the hotspots right now. It does mean that people in Peterborough are having to wait. And so people should expect to wait 2 to 3 weeks following their booking. Right now, we do have appointments available right up until May 24th. There are about 4,500 open appointments at this moment, but I can anticipate that on Thursday, once the bookings open up to people 50 and over, and to eligible workers, that we're going to see those appointments get used up. So it's really eligibility to book that becomes open on these dates.
Okay, great. And so you mentioned 2 to 3 weeks there. Of course, I assume that is an estimate because it's impossible to predict until we have a better sense of what vaccines we might be receiving as the eligibility opens.
So we're working, like right now, for example, we submitted Monday evening our vaccine clinics based on our projections, into June. It takes a couple of weeks for those clinics to be uploaded and to have those appointments become available online. So we're working on June right now, given that we have confirmation of shipments into May. And so we're trying to stay ahead of everyone, but definitely once things open up, for those next few days, there's just there's more demand than we have supply, and so people can expect that the appointments might all go, and there may be no appointments available for a day or two until we can get more online, and they may expect as well that the first opening isn't for a few weeks.
Okay, wonderful. That's everything for me. Thank you very much.
Great, thank you so much. Rob, okay, let's, Danelda Fraser is with us from the Havelock Rail. Did you have any questions for our speakers today, Danelda?
Just one for Dr. Salvatierra. I had a message through social media in regards to the Notify Me that they had registered for it originally, and were notified that they could book. So they tried to book in Peterborough, but couldn't get in Peterborough. So they went to Lindsay. Mm-hmm. Then they got a second notification after, like about 10 days after they'd already had their vaccine on April 9th, I think is when it was. So why would there be the second notification? Is Peterborough not being notified of who's got their vaccines, or?
Well, I can't answer for certain, but what may have happened is that people, when they use the Notify Me system, you can actually sign up for many different eligibilities. And then what'll happen is you're allowed to go whenever your first eligibility it opens up, but you may become eligible other, for other reasons. And it could be that they're just receiving the notifications according to those different eligibilities that they identified. That's one explanation I have. I don't know, Brittany, if you have any other explanations.
Yes, that is correct, that people can sign up for multiple groups, and as each group becomes available, we have been issuing notifications. The other thing is, as more appointments became available, we wanted to send out reminders to groups that we'd already told were eligible, so that they knew that appointments were there for them, because there was a scarcity of appointments at the beginning. So in order to make sure we were filling our appointments as quickly as possible, we did do some follow-up notifications as well.
Okay, thank you very much. That clears that up. Thanks. That's all I have today.
Great, so glad you could join us, Danelda. Okay, I'll now invite Reg Watson from the Examiner. If you've got questions for our speakers, please go ahead.
Are the physicians still administering the vaccinations, and is their role going to expand at all, or is it just for a certain age group still?
Well, they are currently able to vaccinate. They've used up all of the last shipment of AstraZeneca, according to this morning's report. So they don't have vaccine currently, but we are speaking to all of our primary care providers, because now that they have established how to immunize, because they need to use COVAX to do that, we will be able to share with them the other vaccines as well. So potentially they could be getting Moderna. Right now there is a pharmacy pilot going on with Pfizer, which might have some implications for even using Pfizer in primary care. So we'll have to see what the rollout will look like in primary care, and which vaccines our physicians and nurse practitioners will have. They most definitely should be getting more AstraZeneca, especially to do the second doses when they become due, but they could also be helping us with Moderna and Pfizer as well.
Okay, thank you. That's all for me.
Okay, great, Reg. Thanks very much. Okay, well, now we'll come back to Joelle Kovac. If you've got some questions for our speakers, go ahead, Joelle.
Sure, thank you. Dr. Salvatierra, are there going to be any further pharmacies, do you think, in Peterborough? Because I noticed that there's 6 in Lindsay, for example, and there's 4 in Peterborough. So there must be a reason for that, but I just wonder.
We fully expect, Joelle, that we will see an expanded rollout. And in fact, the province did indicate that. I think what happened, though, was that the AstraZeneca shipment that was expected at the end of April was canceled. And so that is having an impact. Essentially, the rollout is on hold while the province now pilots the use of Pfizer in vaccines. And that pilot started last Thursday, I believe, and will continue for the next 2 to 3 weeks. And we should see things maybe starting to move again when the pilot has been completed. Especially, I mean, I'm expecting that what'll happen is that we might see Pfizer being provided to vaccines, and potentially that might mean that we'll also see more vaccines here in more pharmacies here in Peterborough eligible to provide that vaccine.
Oh, great. That's helpful. Thank you. And the last thing I have is I was wondering, it seems like there's a very good availability of appointments into June. How come there's so many open? Like, are people not snapping those up immediately? I'm seeing lots of 40-somethings that are so eager, and man, when it's their turn, there won't be no 2,000 appointments, I don't think. What do you think? What's going on there?
I think, well, again, we're working with our vaccine allotments as they become confirmed. We are able to upload more appointments. I know we worked really hard after Thursday's announcement to try and open up more appointments for all the 55 year of age and over that were eligible. So I don't anticipate, Joelle, that it's always going to look as good as it's looking this morning. In fact, I anticipate that this coming Thursday, we'll be back down to seeing most of those appointments gone. So I think it'll just ebb and flow right now, depending on when the eligibility opens up.
That's really, really helpful. Thanks. That's all I have.
Okay, great. Thank you very much, Joelle. So with that, that brings our media briefing to a close for Tuesday. And I really appreciate everyone's help in providing clarification to those questions from our residents. And so thank you to our media partners for continuing to join us. And we're always open to feedback if there's ways of doing this a little better. So don't hesitate to reach out to me with your suggestions. So with that, thanks again to our speakers. Thanks again to Chief Gilbert for joining us, and Mayor Mitchell, and Warden Jones. So we'll see you back here on Friday. Please stay safe out there. Take care.
Thank you.
Thank you, Brittany.